So I wanted to hand that over to Dr. Uszler to find out a little bit more about SPECT imaging and its role in terms of what does it tell us about kids on the spectrum? What do you see?
Well, as has been mentioned over here, we can't do whether it's postmortem or premortem biopsies. So one of the things that SPECT imaging does, so this is a way of using some tracer substances that go to the brain, that's a functioning brain, and by using SPECT technology, which is just an imaging technology, we can actually make a map of the functional pattern throughout all regions of the brain and can ask ourselves questions that say, what does that pattern tell us, the functional pattern in the brain, and what do we learn from that independent of whatever is the clinical presentation of the person? Now, observing the behavior of individuals is important. Autism as itself is a clinical diagnosis. It's not a scan diagnosis. So we're not using functional imaging to make a diagnosis. We're using it, as Dr. Henderson indicated over here, to say, look at the function patterns. What does that tell us as to how this brain is working versus how that person's brain is working? And how is that maybe related or not related to the clinical behavior? How does that enable us to have targeted therapy based upon the brain function that we see, whatever is the clinical diagnosis?